Yeah, okay, good.
Sir,
Go, keep going, go.
reshuffle. I'm just reshuffling.
Hello.
Hey, how can I help you?
I've got this script for my son. Yeah, he's asthmatic.
Hello.
Okay, it's scripts for Ventolin. And how old is your son?
Yeah,
6.5.
There you go.
Oh, 6.5. Oh, you little cutie.
Yeah, that's okay.
What I'll do is I'll just dispense it and bring it back
Yeah,
to you.
yeah, no worries.
One moment. Okay, so so I've got the script here for Ventolin. Let me just check the patient's history.
Too tired.
Hey.
Too tired.
Oh, okay. Seems that he's had this Ventolin twice in the past week, which is not good news. It just means he's not using it, or there's a high probability that he's not using it properly. So I'll just get back out there and make sure he knows how to use it.
Right, Dad.
Okay, so seems to be a small issue.
Oh, what? Yeah.
Now, your son and yourself have had to come here twice in the past week to retrieve the Ventolin.
That's right. Yeah.
Now, that is a very high dose of Ventolin to be using over a 1 week period. So roughly how many times is your son using his puffer per day?
Oh, 7 or 8 times, depending on how severe it is. You know.
Oh, okay.
Yeah.
That is a bit too much. And what was your name?
Benjamin.
Benjamin. Okay. And how old are you now, Benjamin?
6.5.
6.5. Okay. Well, in Benjamin's case, he should only be using his puffer when required, and it's not recommended to be used more than 3 times a day. So I would just like to see, Benjamin, could you show me how to use your puffer?
Dad.
Yeah.
Dad, can we do it?
Yeah, let's do it, man. Let's do it, man. You know how to do this, right? Let's show the man. Yeah. It's okay.
Okay, so
That was good.
So now you've just administered a dose. You've given him a dose. Is that
Yeah,
right?
that's the way we did it. And
Alright.
he feels a bit better later on, but like after an hour or so, you have to do it again. He's still feeling wheezy.
All right. So it is apparent that he's not actually getting the right dose from this technique.
Oh.
Now, at his age, at 6.5, it is recommended that a child uses a spacer, which is one of these.
Yeah.
I'll explain that in a sec, but I'll just explain to you why first. So, first of all, his lung capacity isn't, it's limited
Yeah.
as a child. And another aspect is you're helping him do this, right? So you're holding it to his mouth, and you press it, and then he breathes in.
Yeah.
This coordination it's very difficult to actually coordinate.
Yeah. I find that he breathes in before I press it.
And then he's breathing out while you're pressing it. It
Yeah,
becomes a big
that's
mess.
right. That's right.
And for him to press it himself as well and breathing in as a child, the coordination isn't as developed.
Yeah.
So studies have shown actually these spacers help the children help the children get the required dosage.
Dad, are we getting that?
Yeah. Well,
Yeah.
what
That's for me?
Yeah.
Yes,
Let's see
yes.
the other one of these. So what I'll do is I'll show you how it's used. So obviously if it's a new puffer, you have to prime it. You know, shake it, take the cap off, puff it into the air a few times. You know? And once you've got that settled, you grab the puffer, take off the cap, shake it,
Yeah. That's good.
and then you place it in the gap on one end of the spacer. Now your dosage is once as required, so you only have to press it once. So you'll be able to do this on your own, Benjamin.
Okay.
You go up, you press it once, you go up,
Gotta take the lid off too.
no, there's no lid, this is just a demonstration. Press it, and then while the dose is in there, because you've already shaken this and pressed it, while the dose is in there, you pull your mouth on the end, breathe in, and hold it in for as long as you feel comfortable. So for about 5 seconds or so.
That
Okay?
seems. You like that?
I think
you like
so.
the way?
I
Yeah.
think it looks better.
Okay,
I think
let's
it's much
see
better.
if you can figure out how to do this. Because you're a
Okay.
smart cookie, I know you can do this.
You
Here,
need help?
here's a spacer. Here's,
You need help, Dad?
Think I can do it, Dad?
I reckon you could do it.
Okay.
Okay.
let's try to give him, let him
Okay.
try it by himself.
Do you remember what the man said first?
Okay.
Yeah.
Yeah.
Yep. Take off the lid. That's exactly. No,
Spray it now?
exactly.
How many times?
Yeah. One or twice, was it?
Into the spacer. So put it into the port where it goes in. You've primed it, right?
I haven't done anything yet.
Yeah.
So what you do is, you press it about 2 to 3 times until it's clearly coming out.
Yeah.
Yeah.
Yeah?
And
That's
then
sufficient.
put it in the machine.
And you press it, that's beautiful.
Yeah.
And then quickly while the dose is still in there, you have
Okay.
to breathe in from the other end
Now you breathe it in. You do what you do.
and hold it in for 5 seconds. or as long as you feel comfortable.
Yeah? How do you feel now?
I think I feel better.
Better than before?
Yeah.
Oh, sweet.
Okay.
Was that right?
That
Um,
was
It
good
needs
to me, I don't
a
know.
little bit of a touch, but yeah, you've got the hang of it. So with practice, you'll be able to do it quicker and more efficiently. But it looks like you finally know how to use your inhaler. What I'll do is I'll pack this, and I'll keep on record here that I've shown you how to use it with a spacer. And I'm going to pack this in the bag for you too. And when you guys come back, I'll have a chat with you and see how things are going, if you're requiring this less. You should notice that Benjamin's requiring this less now.
Okay, so.
Because hopefully he's getting the right dose with the right technique.
Okay, beautiful.
Now,
Yeah, that sounds
this
good.
is a very big problem with a lot of children. And I know you also have Lucy, who's younger, and she has asthma too.
Yeah, that's right.
So
Can I use.
you can't use the same spacer, but what I'll do is I'll pack another one. Alright, and I've got some pamphlets over here actually.
Oh, yeah?
Yeah, they're over here. Here's a pamphlet.
Uh-huh.
I've got the pamphlet here, yeah?
Thank you.
So this actually says the instructions of how to use the spacer with the Ventolin puffer. So you'll be able to adapt this to Lucy's case as well.
Yeah,
So
yeah.
I'm going to pack an extra one of these. An extra one of these. So now I have two spacers. and you'll be ready to go home to Lucy.
Beautiful.
Your wife.
That sounds pretty good. Pretty good?
That's
Alright, that's 10.95, thanks. Thank you.